I'm a board certified family nurse practitioner, and I'm also a certified health and nutritional coach. And then I also I co-founded a blog. It's called Follow Your Gut, MDNP, with one of my best friends who's a physician as well. And today, so we're going to talk about nutrition and autoimmune diseases, okay? This is just a disclaimer that I'm supplying evidence-based information, but it's for educational purposes only. Before you implement anything that I am talking about today, I do encourage you to talk to your healthcare team and get them on board with you, okay? So this is just a little bit about me. I became involved with TMA back in 2012 with the Team Tommy Foundation. My best friend, Lori Boyer, who's on the board of directors, actually started it, and I became involved with myositis diseases and awareness with her. This is some pictures of my partner on the blog, Dr. Erin Shaw. We both graduated from the Institute of Integrative Nutrition, IIN, out of New York City. It's one of the most popular health and nutritional coaching programs that is out there. And reason being is because they provide you the massive amount of information, and then you're also actually being educated by top integrative and functional medicine physicians all over the world, actually. So the presentation overview, we're going to talk about what is an anti-inflammatory diet. We're going to review macronutrients. We're going to review triggers of inflammation. I am going to talk about supplements. I'm going to touch on autoimmunity and gut health. I did do a talk yesterday, which was recorded, so if you guys want to go back to that, it's in regards to the gut microbiome and autoimmune diseases. So I suggest that you listen to that when you guys get back home. And then also I'm going to talk a little bit about the ketogenic diet and autoimmune diseases. So what is an anti-inflammatory diet? There's really not one single definition that's out there, but as far as the overall concept, it's a diet that is consisted of whole foods, nothing processed, nothing from a box, can, anything like that. And specifically, when you are shopping at the grocery store, you're shopping that perimeter. So the basis of, like I said, avoiding processed foods, eating more whole foods, avoiding processed sugars, which we'll talk about. And it is very high in vegetables, bone-based broth. I did put a picture of one of the books that I do suggest. It's by Dr. Amy Myers, who's a functional medicine autoimmune specialist. It's called the Autoimmune Solution Cookbook. She has great recipes in there, and her bone broth recipe is awesome. And then moderate amounts of protein. So whole foods, obviously, we know what whole foods are, where they're fruits, vegetables, proteins, healthy fats, prebiotic and probiotic effects from certain types of food, which we'll talk about, and making sure that everything is fresh, that there's no additives or preservatives in there. So why specifically anti-inflammatory diet for myositis diseases? So back in 2007, there was a study that was conducted as far as following patients with myositis with the anti-inflammatory diet for a 12-week period. And what they saw was there was improvement in grip, arm strength, leg strength, improvement just all activities of daily living. And then also they did see a decrease in depression in these patients. There are continuing studies that are out there. Obviously, because of how rare on the autoimmune disease scale, how rare myositis disease, it's very difficult to find these studies just specifically for myositis. There's also secondary diagnoses to consider. I've listed these, but not limited to, obviously, but the big guys, diabetes, certain types of cancers, Alzheimer's, heart disease, and then also additional autoimmune diseases that can follow. So this is Joshua Rosenthal. He's the actual founder of IIN, and then also he's a primary teacher. But his one-liner that he always says is, one person's food is another person's poison. So what we're talking about is something called bioindividuality. So that means that if one food group works for someone, it actually might be a trigger for another. So it's very important that if you're going to try to incorporate an anti-inflammatory diet or take certain things away, that you really stay in tune with your body on how your body's reacting, good, bad, and different. When my patients are wanting me to help them as far as taking certain food groups away, I strongly encourage them to keep a journal. And when they come back, I usually have them come back weekly during about a 4-week process. Sometimes we go to a full 3-month process, just depending on how they're feeling. But we go through the journal together because there's some things that my patients may think, oh, well, this doesn't really mean too much of anything, but it might mean something to me as far as a clue to help them. So the macronutrients, these are the big guys. So starting with carbohydrates, there's definitely a difference between good and bad. Good carbs, quinoa, brown rice, certain fruits, vegetables, legumes. I did asterisk the legumes because legumes can sometimes be an inflammatory trigger to certain patients. So I do have my patients use those with caution. That's usually something that I try to take away, and then if we, once they've completed 30 days of an anti-inflammatory diet regimen, then we can try to reincorporate it just to make sure that it's not a trigger for them. And then obviously the bad carbs, anything that is white. I mean, that's the easiest way to look at that as far as like breads and pastas and things, because that converts right into sugar. High fructose corn syrup, which unfortunately is in everything. Syrup, sugar of any kind, and that includes artificial sweeteners too, as well. And then refined or processed carbohydrates. So why should you be careful with carbohydrates? Obviously inflammation, they also are responsible for weight gain and obesity. They can increase your sugar. So if you're a type 2 diabetic, or if you have something called impaired fasting glucose, or some people use the term pre-diabetes, you do have to be careful about that. And then also gut imbalance, or something called leaky gut syndrome. So, like I said, good carbohydrates, quinoa, that's a very good source of protein as well, which we'll talk about in the protein, but they don't really consider that, it is in the carbohydrate group, but it's actually a nut or seed. What I do recommend with quinoa is that you soak them before you cook them, because you want to get rid of the biofilm that's around the actual seed. Sometimes that can be an inflammatory trigger. But other than that, it's a great source of protein. Do you have a question?
Yeah.
Okay, I'm going to take questions after the presentation. I made sure we're going to have Q&A. Yeah. So one cup is about 8 grams of protein, of quinoa. Brown rice. Brown rice is definitely better than white. Brown rice is more of a complex carbohydrate, meaning that your body's going to have to break that down, versus white rice, which is just going to turn automatically into sugar. Certain fruits, I mean, overall fruits are fine. It's a good source of sugar. It's not processed or anything, but obviously there are certain fruits that are higher in the sugar scale. We'll talk about sugar in a minute. Vegetables, and then also legumes are a good source of carbohydrates. Bad carbs, going through high fructose corn syrup. Like I said, unfortunately it's in a lot of things. High fructose corn syrup also has different names. What I tell my patients is the only time I ever tell them to Google certain stuff, but Google high fructose corn syrup names, and they'll give you a list of different names that it looks like it's okay, but it's actually the high fructose, it's the processed sugar. Refined or processed sugars, I just talked about that. Anything that is white, You have to be very careful. I'm not saying that you can't ever have it, but specifically if you are trying an anti-inflammatory diet, as far as finding out what your triggers are, you have to completely avoid that. And then artificial sweeteners, which I'm going to show you guys a study, but artificial sweeteners actually will play games with your brain and will tell your brain to take in more carbohydrates. So you think that you're doing a good thing because you're not taking in the high fructose corn syrup, but then it's going to mess with your mind and go, oh, okay, well, I want that bag of chips. So you do have to be careful about that. So proteins, there's an unknown amount of protein that is recommended specifically for myositis disease, but typically I have my patients try to aim anywhere from 15 to 20 grams of protein per meal. And there's different sources. Like I said, the quinoa, if you're on a plant-based diet, is a great source of protein. Eggs, I always just make sure that they're free range, and if you're able to have them organic, that's great. Also local farmers markets, if you live in a place that you are fortunate enough to have a relationship with a farmer. I have a couple of chiropractors that I am friends with that have their own farms, and I'm able to get fresh eggs from them. So it's great because I know what the source is. Steak, I always do recommend make sure that they're grass-fed, and again, if you're able to do organic, that is awesome. I know it can get pretty expensive, but grass-fed is very important. Chicken, I tell my patients, chicken is fine, but just use it sparingly. You want to make sure that that there are free, they're free range. They're not, fed all these additives and everything to fatten them up. Same goes with like beef and pork too as well. But chicken's one of those that can kind of slide in. And again, you go out to dinner, you don't know if the chicken is, was from a happy farm or anything like that. But when you're able to control it at home, that is where that's where that comes in. Okay. Plant-based proteins, specifically pea protein, whey protein, unfortunately, and we're going to talk about that, but does contain lactose and casein. So lactose sugar, casein is actually it's actually going to cause inflammation in the gut. We'll talk about that, but a lot of times patients, there are some that can tolerate it just fine. My husband can tolerate it just fine. Me, causes a lot of GI distress, so I cannot have whey protein. So again, that's where you come back to the bio-individuality and really listening to your body and see how it's reacting. And then also fish, we'll talk about that in the fats, but fish, obviously salmon is the best as far as the omega-3s, and you want to make sure that it's wild caught. Again, that it's not coming from a farm that's being fattened up. So good fats versus bad fats. So omega-3s are the anti-inflammatory. So examples, flax seeds, walnuts, oily fish, eggs. There's obviously supplementations that you can take as well. And we'll talk about that in supplements. But omega-6, those are the ones that induce inflammation. So examples are sunflower oil, safflower, soy. Soy is a big one. A lot of the anti-inflammatory diets, they want soy completely out. And then also corn. Some people react, some people don't. So it's just, again, on how your body reacts. So this is a blog post that Dr. Shaw and I did together in regards to fats. So if you go to our blog and read it, there's a ton of information. And we've also linked different journal articles in there too as well. So these are examples of good fats. Like I said, the oily fish. You do have to be careful as far as like mackerel and swordfish, things like that because of the mercury. So if your doctor is wanting you to avoid things from mercury, you have to be very specific on the type of fish that you're eating. Grass-fed beef and pork, omega-3 fortified eggs, different nuts and seeds. I usually recommend walnuts, cashews, and almonds to my patients. Make sure that they're unsalted, no sugar. You want them in the raw formation. Avocados, everybody loves avocados. They're not only a good source of good fat, but they're also high in fiber, good fiber for gut health. Ghee as far as clarified butter. And then different oils, avocado, there's coconut oil, extra virgin olive oil. I usually just recommend my patients to really try to go with avocado oil. Coconut oil, it's not bad, but I prefer my patients using it externally versus internally because the amount of saturated fats. But it's great for everything else on the outside. So gluten's a big one. Gluten is actually a protein that helps maintain the shape of whatever formation it comes in. Those are the different types that gluten's in there as far as carbs. The Celiac Disease Foundation website is an excellent source. So they have different recipes. You can sign up for their newsletter. They'll send you different educational, articles and everything. So if gluten or if you're gluten-free, this is a great website. You don't have to have celiac just to be a part of that. So the question, we question the relationship between celiac, gluten sensitivity, and myositis because there have been clinical studies that have shown that there's an increase in the anti-gluten. There's an increased frequency with myositis because celiac disease and myositis, there's a pretty large connection between the two. So if you are having unexplained diarrhea and weight loss, and especially if you're taking gluten in and you're having those kind of reactions, you should have your doctor, test you for celiac disease. A diagnosis of celiac disease, there's a very small percentage of patients that are actually celiac patients, but we are seeing an increase as far as the percentage of gluten sensitivity. There are certain tests that are out there. I know there's one that they can actually do like a swab in the inside of your cheek. Unfortunately, insurance does not recognize it, so that would be something out of pocket. But that's something too. And there's different lab tests that you can, the kits you can buy on your own to test for the gluten sensitivity. But even if you have a small amount, it's probably not going to react. But again, that's where it comes back to how your body reacts, the bioindividuality concept. There was also a journal article back in June 2014 that showed a relationship between orbital myositis and celiac disease in a young patient. There really hasn't been too much as far as research between celiac and myositis, but it's definitely something that you want to keep in the back of your mind as far as having gluten in your diet. This is a nice little picture as far as leaky gut syndrome and autoimmune disease. So back in 2000, Dr. Alessio Fasano was trying to come up with an immunization for cholera, and he just kind of stumbled upon the protein zonulin. So what that does is when gluten is ingested, these zonulin levels actually go up and cause inflammation in the gut. And what is happening is that these tight junctions that are supposed to be side by side are starting to spread apart, and it's causing something called leaky gut syndrome, where toxins and food, they actually go into your bloodstream and they systemically go throughout your body, causing overall inflammation. And then other symptoms, fatigue, brain fog. Those are two of the biggest ones. Joint swelling, a lot of GI distress. So those are things to take into consideration if you are having those symptoms. And we're going to talk about the gut microbiome in a minute. So dairy, like I said, whey protein, you do have to be careful about that because of it could possibly be a trigger for you. I've listed some non-dairy sources on there. Almonds, so you're getting a good amount of, calcium source, but then you're also getting the good fats in there. Coconut milk, collard greens. If you put in non-dairy sources of calcium, if you Google that, there are some pretty good lists that are out there. Sugar, so the FDA actually recommends for us to have less than 50 grams a day. Unfortunately, that's about double what we consume as Americans. Sugar can elevate levels such as your CRP, which is an inflammatory marker that I'm sure your doctor monitors. There was a study that showed that consuming 50 grams of fructose caused an elevation within just 30 minutes, and it exceeded well over 2 hours. So it keeps your sugar very high. So a diet high in sugar, it causes a low-grade chronic inflammation, which is going to worsen inflammatory markers, and then it's going to cause a chronic inflammatory condition throughout the body, such as myositis, but that's with anything. That's with autoimmune thyroid, that's with rheumatoid arthritis, it's with MS. So, pardon me, you do have to be very careful about processed sugar. And this is a pretty famous, I saw this MRI when I was an undergrad, but I think that it's just a great visualization to show that it hits the same receptor sites, and it's hitting the same part of the brain as far as cocaine, but it's actually brighter, meaning that area is actually more active. So you gotta be careful about that. Sugar, it increases your gut permeability. So what that means is that it causes those junctions to start spreading apart and causing inflammation in the gut. It's also the reason for weight gain. It actually causes your bad cholesterol to go up. So when you're looking at a cholesterol panel, obviously it can make your triglycerides to increase, but it's also the responsible source for making the LDL go up, your bad cholesterol that causes plaque buildup in your arteries. The worrisome is fats and everything like that, but what they're finding is it's actually sugar, carbohydrates. So good sources of sugar are whole foods. Like I said, the fructose in the fruits, it actually is, it is a good source, and it, as far as breaking down, your body has to work for it. It doesn't just convert it and possibly cause those side effects of sugar right up there. So bad sugar, usually, how it's formed is that it's actually taken out of its original source and then processed and placed back in. So high fructose corn syrup, corn sugar, straight glucose, evaporated cane sugar. That one's not too bad. It's in a lot of kombuchas, but again, if you're on a strict anti-inflammatory diet, you can't have those sources in there. So alcohol. So as far as alcohol goes, the best one would be red wine. The recommendation is 1 glass a day for women, max of 2 for men. But there actually was a very recent study that just came out in the Journal of Gastroenterology showing that having 1 to 3 glasses a week showed an increase in the good microbes in your gut. It actually was causing these patients to form more good bacteria and suppressing the bad. So, and they're thinking it's because of the polyphenols, which people know about, in regards to cardiac health, raising the good, lowering the bad. It can also improve blood pressure. There's been studies showing it increases your insulin sensitivity. So what that means is that it helps bring your sugar down. But as far as with myositis and the concerns, obviously alcohol interacting with certain medications, it can worsen inflammation or dehydration. I tell my patients if they are, again, across the board autoimmune diseases, if they're going to have an alcohol beverage, to try to drink at least 16 ounces of water in between, so that way you do stay well hydrated. It can increase feelings of depression, fatigue, and it can elevate your inflammatory markers too. So this is what the study I was telling you about in regards to artificial sweeteners and soda. I strongly encourage my patients to not have any source of soda whatsoever, and it's really difficult to wean them off. It's probably harder to do that than having my patients stop smoking. But this is an article that was published in 2017. The basis of it showed that patients who are drinking artificial sweetener sodas on a daily basis, they actually have a three time higher incidence of developing Alzheimer's dementia, or all-cause dementia, just dementia of an unknown source, or stroke. So it was a pretty compelling study. They had a good amount of participants and everything, so, but it just showed what we already know as far as healthcare providers. And then there was another one that, this was directly just Mexican women. They didn't have any kind of chronic conditions whatsoever, but I think it's just important to show that when they were consuming soda, they actually had higher levels of their CRP, and they had no chronic conditions whatsoever. So supplements, start with the curcumin. So that's the active ingredient is turmeric. So you can either do turmeric or curcumin. It helps decrease inflammation, cell growth, and cell death. A lot of my chronic inflammatory patients, they do take it as far as a source to decrease inflammation. It alleviates something called oxidative stress. So oxidative stress can cause a lot of issues, cardiac issues, worsening autoimmune diseases, can actually contribute to gut imbalance. You know, a lot of, like I said, a lot of my patients, they do use it. The worrisome is actually absorbing it. There are a couple of things as far as consider it. You want to make sure that there are something called piperins or black pepper in there. I have some of my patients, they will take an actual supplement, but then they'll also use fresh turmeric in their cooking. So I'm going to take questions afterwards. You know, if they want to get a little bit extra of that, they do increase your bleeding risk. So I do have my patients stop that 7 to 10 days prior to any procedure as far as bleeding. It may increase risk for cardiac disease. And this is a conversion as far as COX-1 to COX-2, it's cardiac inflammation. So we just gotta make sure that the cholesterol is under control. Someone in the last session did mention something about their doctor saying that the blood pressure was increasing with it. I haven't found anything, but I'm still looking. But as far as cholesterol goes, we do wanna make sure that that is under control. But you'd have to take massive amounts of curcumin to cause that kind of cardiac inflammation though, like massive. Vitamin D, it's a very popular vitamin that's out there, and it should be, because clinical research that has rolled out and continuing to rolling out is that vitamin D deficiency, one, it's something that we all have. Because we are not absorbing it, we're not getting viable sources. You know, I live in Florida, and we should all have great vitamin D levels. I've seen some of the worst in my sun worshipers. So we want to make sure that we keep that. Everybody's going to have a different range. My range is between 50 and 90. There are some functional medicine doctors out there that try to keep their patients in the hundreds. I feel like that is too high because too much of a good thing is a bad thing. But as far as the clinical studies go, they really find benefit greater than 35. But keeping your number between 50 and 90 is truly ideal. It has been studied, there's been myositis studies as well. There was one that I did find in 2013, and it was showing the correlation between low vitamin D and idiopathic inflammatory myopathies, and they did have test groups of along the line of different types of myositis. There really was a significant difference between any of the groups, but across the board, they are showing that there's low vitamin D levels. They don't know if that is a problem as far as a trigger, or if that's just something that does happen with autoimmune diseases. And you know, obviously there's other things that can happen with low vitamin D, so we want to make sure that that is sufficient. So this is just, and all these slides they're going to be available. I can email them to you if you want, no problem. But these are just different sources as far as vitamin D. I think it's notable to look down at the bottom that milk and cheese actually have some of the lowest levels of vitamin D that's out there. So, you know, if you're drinking a lot of milk, you're eating a lot of cheese, anything like that, you're really not getting a good amount of vitamin D in those sources. So supplementation is ideal. So just discuss it with your specialist, you know, different things, you know, the side effects, make sure that, you know, a big important thing is making sure your kidney function is fine. It's not going to interact with any of your medications. It really shouldn't. And then what your goal is, and then continuing monitoring. You don't want to get on a supplement and then, okay, we're just going to check it in a year. No, you really would like to see another number between 3 to 6 months. And then fish oil. So fish oil, there's no recommendation as far as cardiovascular protection. That's kind of been debunked. So it's not going to prevent a heart attack or stroke or anything like that. But it is really good as far as chronic inflammation because it's going to, the omega-3s, they're going to decrease chronic inflammation. So if you are able to tolerate them, some people can't. It can cause, burping, belching. There are different, sources that you can use. One thing that I do tell my patients is that you can actually freeze the capsules and then take them frozen. And by the time that they start dissolving, they're actually out of the stomach and they're in the small intestine. So you shouldn't have the burping with it. You do want to make sure that you hold those 7 to 10 days prior to any kind of procedure because, again, bleeding risk. And then I do mention folic acid just because it is a very important supplement to take with methotrexate. And reason being is because if you don't, it can cause hair loss, GI symptoms, it can lower your white count, which makes you more susceptible for infection. The recommendation usually is 1 milligram a day, but again, talk to your provider about that, but usually it is 1 milligram a day. And I do make sure that my patients take that in conjunction with B12. You can either use a sublingual source, so like a liquid. The tabs I really don't have my patients use. I have them do a liquid. But if they're not afraid of needles, that's really great because B12 injections are the best thing. And then there's also, food sources, dark leafy green vegetables, eggs, red meats. Those guys tend to be higher in B12 and folic acid. B12 and folic acid are like sister vitamins, so they go hand in hand. And then supplements to be leery of. Reason being is because I know that you guys might be taking these, but there's not any clinical research that really supports the benefit. Glutamine, L-carnitine, I know people use that as far as muscle recovery, prevent muscle wasting. But again, there's not really a whole lot of data out there. Vitamin E, again, there's not a whole lot of data. Vitamin C, be leery of that. Vitamin C is really good as far as boosting the immune system to prevent the common cold. So if my patients who have any type of autoimmune disease, if they're going to be, flying or anything like that, I tell them, 1,000 milligrams of vitamin C a day. Do that about a few days before. Do it, and then do it throughout your trip, and then, you can stop it when you get home. But that can help boost your immune system. And then obviously, like I said, the whey protein, you do have to be careful about that. But there are some patients. One of the patients in yesterday's talk, she said that she's been taking whey protein for I think the last 6 years, and she, it's a great source of protein for her, and it's the only source she can really take because she's having difficulty swallowing, and she's fine with it. So it just, again, it's that bio-individuality, how you're reacting to it. Probiotics, they're not the forefront of treatment, but they do have some credibility as far as introducing good gut bacteria into the small bowel. Prebiotic versus probiotic foods, incorporating those in. If you Google prebiotic foods, a whole list will pop up for you. So there's tons of different sources, and prebiotic just means that the good bacteria that's already in there, you're feeding it, so you want it to thrive. Probiotics are introducing new good bacteria in there. You want to make sure that you have high, what they're called CFUs, colony formations. You want to make sure that the strands are diverse. You want to make sure it's not just like 1 or 2 strands. You want to make sure that there's a good amount. And then the stability, some of them, so like that one right up here, that one actually you can just leave by your sink, it's totally fine because of the way the bottle is. This one I recommend a lot to my women. The raw formation, that one, and they do have a men formation as well. But this one does have to be refrigerated in order to keep it viable. And then gut health. So why do we care about the gut? Well, as far as your gut goes, 80% of your immunity is actually produced in your gut. 90% of your serotonin, which is a feel-good hormone, it alleviates feelings of depression and anxiety. 90% of that is produced in your gut. we used to always think, okay, well, we give you Prozac or Lexapro or anything like that. It's actually elevating the serotonin in your brain. No, actually, it's elevating the serotonin in your gut. And it's helping something, a communication system called the gut-brain axis. So if you go back to my gut health talk, I did talk about that a little bit more extensive, but essentially they're calling your gut your second brain. So if there is disarray as far as that communication goes through the vagus nerve, that information is not getting to your brain, so it's causing symptoms of depression, anxiety, fatigue, brain fog, dizziness, lightheadedness. There's a lot of different symptoms that patients come in with. So there is definitely a correlation between your gut health and autoimmune disease. And like I said, Dr. Alessio Fasano, his very famous study as far as the leaky gut syndrome, basically what he is showing is that we used to believe as far as autoimmune flare-ups are, what the triggers are, genetic makeup, and then it's your environmental exposure, and it goes to there. But there's actually a third addition now to the paradigm regarding the intestinal barrier and the leaky gut syndrome. And like I said, in that study, when gluten was removed, those levels, the zonulin levels went down, so it allowed the gut mucosa to heal itself and decrease inflammation and brought those junctions back together. In that study, he did, it was heavily based on celiac disease, but he also was mentioning type 1 diabetes, Crohn's, asthma, irritable bowel disease, which Crohn's falls into that too. But those are autoimmune type of diseases too as well. And it's important because celiac disease and myositis do have a heavy relationship with one another. So it is questioning, autoimmunity and it started this whole new outlook as far as looking at the gut and why it's important. And then ketogenic diet, so that is, main energy source is fat, not carbs. There is a lot of controversial kind of back and forth going in the healthcare community about it. When my patients come to me and they're like, Jackie, I want to get on the ketogenic diet, what do? I say, there's a good one and there's a bad one, and we're going to go on the good one. I don't want your cholesterol going crazy. I don't want things becoming worse. So I really have to go through that with a fine-tooth comb with them. And, if they want to get themselves into ketosis, someone asked me, is there any problem being on that, long term? I usually tell my patients, you could stay in ketosis anywhere from 3 to 4 months, but then you got to get yourself back out of it, because ketones in your urine should not be there. That is something that, as a healthcare professional, if we see that on a urine analysis, we go, okay, what do we got going on? Do we have diabetes? Do we have uncontrolled blood pressure? Is something going on? Is there kidney disease going on? When you put yourself purposely into ketosis, we expect those ketones in there. The problem is that we don't know the longevity of it. It's fine right now, but we don't know what's going to happen in 20 years if you stay in that state of ketosis. So there are clinical studies that are going on. We just have to give it a little bit more time for those answers. There is a lot of data supporting ketogenic diet with Parkinson's patients, Alzheimer's. It is showing positive outcomes with those patients too as well. But you do have to keep your healthcare provider on board. If they say, no, absolutely not, say, work with me here and really try to have a dialogue. Don't just, and then walk out and go ahead and do it yourself. You really need them on board with you. Let's see. And honestly, I've tried the keto. My husband does great when he's in a ketosis type of state. His body does great with it. I tried it. It actually made me feel terrible. I was tired all the time. My brain was foggy. I actually gained weight on it. So my body does not respond very well to it. But he does fine on it. But I make sure that he incorporates good carbohydrates. I don't want him in a state of ketosis the whole time. So these are books that I do recommend. There are some great reads if you want to expand your knowledge as far as gut health. You want to educate yourself, regarding anti-inflammatory diet. And then also I listed some podcasts and also some great resources as far as social media goes. Dr. Michael Ruscio, if you don't listen to podcasts, try to start. He is an excellent resource. That's this lady right here. That's Danielle Bellardo, Dr. Bellardo. She actually has started a plant-based clinic. She also is an interventionalist, so she does like the procedures on patients as far as like catheterizations and stuff. But what she's doing in her clinic is pretty awesome. She is basically reversing cardiovascular disease with her plant-based clinic. It's pretty awesome. And then Dr. Mark Hyman, he's the director of functional medicine at Cleveland Clinic. I love his podcast because he's so popular and he brings like great guests on there. So he does have a lot of great information, but it's the people that he brings on that podcast that's excellent. And then Dr. Amy Myers, this is Dr. B. I can't pronounce his whole name. He's got a crazy last name. But Dr. B, he's a gastroenterologist based out of North Carolina, but he primarily focuses on gut health. So he brings a lot of great resources on too as well. So this is just a basic summary, anti-inflammatory diet. It consists of whole fresh fruits, vegetables, lean proteins, healthy fats. It's making sure that you're avoiding processed foods, high fructose corn syrup, the bad carbohydrates. Always remember, one person's food is another person's poison. So bioindividuality, if you are going on an anti-inflammatory diet, you really need to be in tune with your body and listen to your body. Gluten's been shown to be a high trigger, the different supplements. The gut contains 80% of your immunity. So if you don't know anything about gut health, start trying to educate yourself because it's very important, very important. And then always discuss everything with your healthcare provider and get them on board with you, okay? And then always remember to follow your gut. And then right here, this is different ways to reach me, get in touch with me. Dr. Shaw is also aware that we're going to, emails and everything like that, so she'll be returning some as well. But if you guys ever have any questions, anything like that, I'm here for you. So thank you. All right, so I can take questions. I don't know if I have anybody to run here. Here, I'll start here and I'll work.
I have a quick question. I have dermatomyositis, but a lot of the testing that they worked up, my alkaline levels are a little bit lower. So I started to work on trying to, do some alkaline foods to help. But what is the alkalinity of the body anyway? What does it do?
So are they saying that you have too much acid?
My alkaline levels are low, but I know because I have the autoimmune going on, I've been trying to do a clean diet. But I'm just asking overall, when you do the alkaline water, what does it actually do? I know it has to do with your pH.
Yeah, so bringing your pH level. Honestly, I don't do that type of testing. That seems pretty, more in depth. Is that your rheumatologist that did that?
Yes.
Okay, so that seems more extensive than what I usually do with my patients. So I can find out for you. One of my very good friends, she's an excellent she's the only rheumatologist I trust in my area. She's a nurse practitioner, but she's studied with some of the greatest rheumatologists out there. So if you email me your question, I can actually forward it to her. She already knows that I'm going to be sending her stuff and everything. Okay. She's a great resource. But we can find out. Okay. Yeah, we can help you with that for sure. Yeah. I think she was. Yeah, and then we'll just. Okay. I can actually give you this microphone and then.
Good morning, everybody. I have two questions.
Okay.
Can you go back to the summary screen?
Yes, ma'am.
And then also, as far as like vitamins, I don't know if you talked about this already, and autoimmune and inflammation, do you would you recommend that? Because I try to take a lot of vitamins to kind of counter what the side effects of the prednisone and methotrexate and all that stuff. And I wanted to know like what you think about that. And then I see like a holistic doctor too, and he talked about ubiquinol. And so he said like our body creates a certain amount of ubiquinol, but as we get older, of course.
So that's CoQ10.
Yeah. CoQ10. So
yeah.
I just wanted to know what you like. That's my thinking. Like, well, let me take and I do feel better with them. I can tell the difference.
Okay.
But what do you think about that? The autoimmune conditions. Like, what other vitamins would you recommend for people with autoimmune like us that have this thing?
So there, if when you go back to the slides, I did talk about certain generalized vitamins that are fine as far as overall inflammation. I mean, that goes through autoimmune diseases across the board. What I usually tell my patients, if they're on a good amount of supplements, I tell them to bring them in. And then we go through them together. And then I can kind of help them as far as, okay, do you need to take this? Are you taking enough? Are you taking too much? And try to work basically a cocktail for them to where they're not going to hurt themselves, but also you want to make sure it's sufficient. CoQ10, that was a slide that I used last year. I actually took it out because there's really not a lot of data supporting any of that. There's no problem taking CoQ10. If my patients are on a statin, I put them on CoQ10, so it prevents any kind of myopathies. Even if they don't have any issues, I still have them on it because it is shown that statins decrease that. So it's fine. There's no problem in it. My mom takes it because of brain health as far as with Parkinson's disease. My mom has Parkinson's. So there's no harm in taking it. And if you feel good on it, that's the most important thing. Yeah. So it's just making sure that my patients are taking a sufficient amount and that it's not anything that's going to hurt them in regards to vitamins. Because I have had patients put themselves into a drug-induced hepatitis because of taking too many supplements. Yeah. Some of the highest liver enzymes I've ever seen was in this lady. She was in her mid-40s and she came in, she had this whole list. First of all, she told me she was taking no medications. And I said, well, what about vitamins and supplements? She was like, oh, here you go. And it was like a whole notebook page of vitamins. And I'm like, oh my God. I was like, well, you got to start looking at this and breaking it down. And before I could even start working on it, next thing I know, I do blood work on her. Her liver enzymes were in the thousands. And I had to send her down to university in Miami. Yeah, it was scary.
Okay. I've often heard people saying they go on fast.
Yeah.
It's a way of cleansing your body or something. What's your thoughts on that?
So Dr. Mark Hyman, he has a couple of good podcasts that are on there in regards to fasting and mitochondrial health and everything. To be very honest with you, that's one of the things that, I'm still trying to wrap my head around it because it's so complex. In regards to fasting, we really don't know too much about it as far as the longevity, if there's going to be any problems, later on, 10, 15 years from now. But if it's done safely and you're monitored properly, there's not going to be too many issues. There was a clinical study Dr. Ruscio talked about in regards to fasting and cardiovascular health. And the group that did the best, as far as best outcomes, was a 36-hour fast, which that seems really intense. But there are patients that, they fast and they feel better because in regards to gut health, the theory is that with the fasting, you're starving the bad bacteria and you're actually going to allow the good bacteria to thrive. You're not really giving them much triggers or anything like that, but it's making sure that when you do eat, that you are eating foods that are going to help you, not hurt you. So it's not, fast for 12 hours and then, 12 hours you can eat whatever you want. It's a certain strict regimen that people go by. As far as my patients fasting, we talk about it, they bring education in, we go over it together. Like I said, biggest thing is communication. And I really honestly feel in medicine, conventional medicine, we've lost that. and having to see patients every 15 minutes and in and out of rooms and everything like that. So I really try to give my patients all my time, which sometimes makes me run behind, but my patients do understand that I'm running behind because I'm giving that time, and I give them that time. And then, also I give them my email address, so if they find anything, they can just email it to me. Some providers are like, well, I'm not getting paid for it. I don't care. I mean, I'm helping people. That's what I got into medicine for. And then it's just educating yourself. I mean, to be very honest with you, between Dr. Shaw and I, we've had 2 classes of nutrition in our training. So that's why we did the extra training and became health and nutritional coaches, which anybody can really do that, but we did it for the education, and it blew our minds as far as being in medicine. So I know I kind of went on a tangent on that, but the fact of the matter is communication between you and your healthcare provider in regards to fasting, and just making sure that you do it safely.
You mentioned that when doing turmeric, that by alone can do a little harm somewhat, or someone had problems with it just turmeric. But if you do it with ginger, like turmeric powder and ginger powder together at a high grade, they work together with your inflammatory, and it helps with any other issues like your gut, the stomach. I use both of them together, and it's a high quality one. It's pure, not the ones at the store. That's organic. And then gluten.
So let me start with that first question. No, I was just making sure, as far as with turmeric, you want to make sure that it has the piperines in it, the black pepper, as far as for absorption. You don't want it by itself. By itself, I don't think I said anything about it being harmful.
Well, that's what I did with the.
Yeah, and ginger's great. Ginger's great. It's a great anti-nausea supplement. My patients, they use it for different things that are, that they want, but I have no problem with that.
Yeah, I'm just saying that when you use both of them together, the ginger with the turmeric, you don't have to put the black pepper in it, because the ginger helps you to absorb all your nutrients.
The ginger's going to increase the absorption of that? Okay, I'll have to look at that. Okay, all right, thank you.
And also, you're talking about gluten.
Yes, ma'am.
And I don't have celiac, but I have gluten intolerance.
Yeah.
So, so it does the opposite for me. Is celiac, you mentioned like diarrhea. For me, I get constipated.
Okay.
Yeah.
So it decreases your GI motility. It slows everything down probably. Yeah, okay.
So when I'm doing the supplements or ketogenic diet or the turmeric and ginger together, I have no troubles going.
Okay.
So it's a benefit in doing supplements, but you have to be careful that you're not taking a whole bunch.
I agree with you.
You have to have the kind that, like I said, 100% organic and pure, but in the right proprietary. They have it together where you don't take a lot.
Yeah, when you find a supplement that say a proprietary blend and they're not telling you that, be very hesitant. Because you want to know what you're putting into your body. You want the exact. And you can always contact the company, and they should be very transparent in letting you know. But your testimonial is a great example as far as the concept of bio-individuality and really being in tune with your body and knowing what works for you.
And the omega-3s you mentioned, those are awesome. Omega-3, 6 and 9 together, the right proprietary, again, 100% organic and pure. It does wonders. When I'm doing these things, I can tell a difference in my body, pain in my joints, everything. I feel great. And then when I'm not able to afford it, I can tell every day it almost like reverts. It goes backwards.
Yeah.
So.
Okay. Thank you. Thank you. She's next. Thank you.
Morning. I had a question. You mentioned that quinoa should be soaked. Can you do the same thing by just washing it? Because I've washed it and not soaked
You can wash it, but the recommendation is to soak it. I have my patients, I'll tell my patients soak it for about 4 hours. Some will go as extreme as soaking overnight. So it depends on them. As far as like in our house, we just wash it. We don't have to go that extensive as far as preventing any inflammation. But I do have patients that are very worrisome when they do take, because it possibly could do that if they don't get all of it on. They just soak it overnight, and there's no problem. It's not going to hurt it.
Okay.
Yeah.
And you prepare it the same way?
Oh yes.
Okay.
Mm-hmm. Yeah, absolutely. Yes. Here.
This slide, on your slide about good sugar, you mentioned or listed Firebrand protein. And
So-
what is that?
Okay, so it has a Firebrand protein. So it's going to, with the Firebrand protein, okay. So in fresh fruits, that good sugar, the Firebrand protein has been shown not to spike your glucose. So it keeps your glycemic index being more stable, okay? So it contains a Firebrand, but the fruits contain this thing called a Firebrand protein that keeps the sugar stable. Yeah. Yeah, so we have like a few more minutes, so we can take 3 more questions. Yeah, the 3 minutes. And if you guys have any other questions, I'm going to be here all day, kind of roaming around. So if you have any other questions, just stop me.
Hi, thank you. Very interesting talk. So 2 questions. Fruits. I've heard that grapefruit and rhubarb are quite inflammatory. I don't know if that's true or not. And then your thoughts on honey as a replacement for sugar.
Okay. So first, grapefruit. Honestly, it depends. Obviously, if you're taking cholesterol medicine, they don't recommend the grapefruit because of blocking the medication. But as far as inflammation goes, I have patients who have autoimmune diseases and they take it and they do totally fine on it. But you could react to it. If you're looking on an inflammation scale, it tends to be on that higher end. But I have some patients that they just do totally fine on it. Rhubarb, did you say rhubarb? I'd have to look into that right there. But the education's out there as far as if it's highly inflammatory or not. Again, it's just how your body reacts to it. If you do totally fine on it and your numbers stay good. Okay, so this is the thing when I tell my patients with any autoimmune disease, so from my thyroid patients, my autoimmune thyroid patients, they will know that their numbers are off even before I get the test back. And the test can come back looking normal, but they're like, Jackie, I feel like X, Y, and Z. It's like, yeah, because you're gonna feel it before it converts into a plasma level that I can look at. So if you're taking in those certain foods and you're like, man, my joints are achy, or you're feeling more fatigued, or that fog, or anything like that, you feel more weakness, then we gotta scale back on that, and then it's just finding if you can take in small amounts of those certain types of foods, or if you have to eliminate it completely. Honey being a source, that's fine. We buy our honey from a local farm as far as preventing allergens and everything in our area. So I do highly encourage that. I don't recommend buying it like Publix or anything like that. Buy it from a local and hopefully organic source, but at least a local source. And usually I just recommend 2 tablespoons a day is perfectly fine. Yeah.
I had a question about the quinoa. I buy the one in the bags that you just
The quinoa?
Uh-huh.
Okay.
So that one doesn't get to be rinsed. It's just you put it on. It's already in the little baggies and you just steam it.
Oh, okay. Yeah, no, I'm talking about the raw formation. Yeah, I'm talking about the raw formation. Obviously, yes, you can't do anything with that.
And the protein per day or per meal you were mentioning, 15 to something?
15 to 20 is usually the recommendation as far as what we want to aim for. If my patients are able to tolerate that.
Okay. You just mentioned the protein. So, would you say that for people so I have the muscle loss too.
Okay.
So I'm working on maintaining what I had left.
Mm-hmm.
So I know that I kind of looked up what amount of protein I should be eating or taking every day. And I wasn't anywhere near it, because I went based on my weight, like I'm 6 feet tall, and I'm bigger, you know? So I know it said that I should be consuming 68 grams a day, and I just calculated the way that they said. So I get like plant, if I'm not able to get enough protein via salmon and stuff like that, I get the plant-based protein powder things. Is that good?
That's fine, yeah,
Okay.
that's
I
fine.
do a lot of Garden of Life stuff.
Oh, I love Garden of Life.
Okay, so that's good.
Yeah,
Okay.
yeah, that's fine.
Okay.
All right. Okay, so we ran out of time, went over. But again, if you guys have any questions or anything like that, don't hesitate to stop me. Also, all my information, I'll put it back up there. And if you guys